Some of these are pretty interesting EKGs and are going to have some very subtle abnormalities and things you may not see very often, but I think they'll be very beneficial. So this is my 7-step approach to analyzing an EKG. And the first step, which isn't one that I feel like is commonly taught, is super important. We're never analyzing an EKG in isolation. We're looking at a patient, we're seeing their chief complaint, we're seeing if they're sick and not sick, and we're asking a question by obtaining an EKG. And when you think about the patient's chief complaint, are they complaining of chest pain? Are they complaining of palpitations or shortness of breath? All these different chief complaints bring different differentials to your mind that you're going to analyze the EKG based on. And if the patient has a great blood pressure, if they look not sick, are we likely to find something on the EKG? Probably not as much than if the patient looks very sick and has a very poor blood pressure. We might find something more pertinent on the EKG based on the patient's presentation. So the basic thing that I want to get through with this first step is, what question are we asking by obtaining an EKG? We're asking, am I or no am I? We're asking dysrhythmia or normal sinus rhythm. And we're also gleaning other subtle information about the patient based on their EKG.
Fundamentals chapter free at practicalems.com.